and food, that's a big issue because really women working and then you have fast food, and look at all the fast food places. Well, the first fast food place, McDonald's, was called the Big M in San Bernardino, California when I was in high school, right? And how they're like everywhere. So it's so crazy to be telling people or recommending for like 35 years about people reducing sugar and eating better when our food chains only got worse, right?
Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. This information is not to be interpreted or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, and treatment. Hi there. Welcome to this week's episode of the Dutch Podcast. Today's guest really brought us down the road of integrative medicine and the path and the way that things have changed over the last few decades when it comes to the growth of integrative medicine, naturopathic medicine, functional medicine, and more. We really started because we wanted to talk about stress. That's why we had Dr. Beeson on the podcast. But we got a chance to also talk quite a bit about what it's like to be a naturopathic doctor, how naturopathic medicine is different from functional medicine, and really the fact that so much has changed and there's been so much growth in this industry that's really opened up the opportunity for people to engage in these preventive strategies. And also there's pieces of it that are critical that we've moved away from. And I don't think I've heard anyone describe these elements so beautifully of the things that we need to do to really make integrative functional naturopathic medicine even better for the next several decades. I can't overlook that we also talked about stress in a lot of depth today. We covered some of the complexities of assessing stress, and also talked about if you're a provider in a rural community or you might have patients who are not economically able to do a lot of advanced testing, how can you assess their stress? What symptoms and signs might you look for in their presentation, even if they don't tell you they're stressed, that might point to it? And then what are the most important lifestyle strategies that you can take to really make an impact for those patients? Or if you're a listener, what you can be doing for yourself. Dr. Beeson also shared her favorite supplements and herbs and things like that. So you're going to get so much out of this episode. I'm really, really glad that you're here today. Now, Dr. Margaret Beeson is the founder of Yellowstone Naturopathic Clinic in Billings, Montana, and she has more than 40 years of experience in integrative medicine. Her background spans working in the Navy, nursing, midwifery, working as a physician's assistant, and now doing naturopathic primary care. And she brings a very comprehensive and integrative approach to wellness. Dr. Beeson is also the co-founder and president of the Naturopathic Education and Research Consortium, and she's been recognized nationally for her leadership in advancing naturopathic medicine. She's been a big mentor of mine for literally decades as I was a student. She is so welcoming to new people entering naturopathic medicine. So many of you probably have engaged with Dr. Beeson at conferences, maybe even on the dance floor because she can tear it up. So before we waste any more time with her bio, let's go ahead and dive into today's episode. So Dr. Beeson, thank you so much for being here with me on the Dutch Podcast today.
It's my pleasure.
Now, we go back a long way. I've known you for a really long time. You're one of the people that I looked up to the most as I learned naturopathic medicine and became a leader in the field. You've always been a supporter of all people, but women especially, and people who want to do more work in the field. And so just starting by saying thank you.
My pleasure. Thank you. It's an honor to be a naturopath and to be part of our profession. It's our tribe, right?
It's absolutely a tribe. Before we dive into our topic today, which is really centered around stress and women, and of course, there's so much to talk about there, I'd love you to share a little bit of your backstory because you have such a unique backstory. You're a naturopathic physician. You've been practicing for many decades in Montana, and really someone who's, from my point of view, carried the heart of naturopathic medicine for a long time and through a lot of transitions in medicine in general. So can you just share a little bit about your backstory for listeners who may not know you?
Okay. Well, I when I graduated from high school in 1968, nobody really said, did you want to be a doctor to most women? There were probably a few. And in looking for a career, it was kind of the choice was nursing or secretary or teacher, right? So I thought, okay, well, I'll be a public health nurse because that would sort of suit having an opportunity to be of service to people. I'm a Virgo, so service is,
I'm a Virgo too. Yeah, that's why we have that service connection there.
Yeah, right. Definitely. I think I knew that. So I went to school in San Francisco, University of San Francisco in 1968. So the school was going through a big sort of revolution in a lot of ways. And this Catholic Jesuit college I went through to was a couple blocks from Haight-Ashbury. So it was definitely an experience for me to be in the middle of that. And so I started questioning whether nursing was right for me. Ended up, working in a health food store during that period of time, which was really interesting to have people come in who had sort of been given up for dead and started taking supplements, and that made a difference in their lives. So that intrigued me. And I worked in restaurants and sort of in the food industry. Worked at mental health services. Did some work in one place like that, just sort of as I think was a volunteer. Anyway, and then I decided I found out about physician's assistants, and in 1970 there were only 2 programs in the country, and you had to have already been in the military there were actually set up those programs for people who had been in Vietnam to use their skills, right? And so I'm like, okay, well, I think I'll try and see about joining the Navy and becoming a PA. So I joined the Navy and became a hospital corps person in the Navy. And it was interesting because in 4 years of doing that, if you really want to work and learn, you can do everything. So I worked on all kinds of wards and floors, and then I ended up getting in this pilot program because they dismantled their PA program. And so this is at San Diego Naval Hospital, where it was a massive outpatient clinic, and it was called the NAMIC program, where we were trained with an internal medicine doctor for 6 months to see there were 12 of us to see patients in this little room, and the doctors would rotate through. So we had 20 minutes to see a patient, and we would do their physical exam, figure out what was going on. And then, so this was 1974 or 5. And then we would go out and talk to the physician and either refer to some department or order lab work or whatever, but we'd always do this physical. So that, at the same time, I was taking extension classes and learning a little bit more about nutrition. And so it was definitely like, how am I going to marry these two things? So I thought when I got out of the Navy, I would go to medical school. So I went to UC Davis pre-med, and it was there that I challenged the boards of, if you're in the military and have that training, you can get your nursing license. So I got my nursing license in California and worked as a nurse while I was going to pre-med. And that was pretty cool. I got to work in all different hospitals and wards, and I really learned a lot. And I also was like, well, someone handed me a catalog of naturopathic medicine, and it just fit. And so then I needed to finish my pre-med and do some other things. And finally, and I ended up working for this doctor in California. That was in 70, I think I worked for him for a couple of years in the early 70s. And he was a clinical ecologist. So that was the time when that people were looking at chemical sensitivity for the first time. And he was doing provocative neutralization testing. Actually met Dr. Cronin going to the first Man in His Environment conference down in Texas. He was a naturopath. I'm like, oh my God, that's what I want to be. Look at this beautiful human being, right? And then I also went to Alan Gaby and Jonathan Wright and met Dr. Steve Austin there. And so these were my models for these amazing, they were asking the most intriguing questions, the most intelligent. I'm like, I want to be a naturopath, So finally went and got accepted in 1985 and graduated from naturopathic medical school, and did my residency with Dr. Milliman, who was family practice and fabulous, and did a residency there. And also I wanted to be a family practice doctor out in a rural environment, so I did midwifery as well. And then went to India to do childbirth in Amsterdam and England. Got our student loans after I graduated from medical school and traveled the world doing childbirth. So And then I came to Montana in Billings, where I've been for 33 years, and really thought of myself. I think my first article I wrote in Dr. Milliman's newsletter was being a bridge between naturopathic and conventional medicine, really recognizing that it isn't, an either or, that it's really that whole spectrum of people having access to the proper tools at the proper time and educating them for what's available. So that's my story.
I didn't know all those things, particularly about your military service. That's amazing. And what an interesting way to start your medical career, because I'm sure you saw pretty severe disease, things that a lot of naturopathic doctors don't see in their typical training today in an outpatient only type of setting.
Yeah, it was serving retiree and dependents, so it was whole families of care. And then I ended up, the person who was head of the program, the outpatient clinic, wanted to start a chronic care clinic. And so this nurse and myself ran this clinic for about a year for diabetes and high blood pressure. And so that was really interesting, because this, again, was in, I got out in 77, so it was probably 1976. And I can remember being in a support group for people with diabetes and suggesting that people not eat sugar. And I was an absolute heretic. I got in trouble afterwards, right? I was like, wow, that was like, it was like, all you have to do is do insulin, and your blood, we didn't even have hemoglobin A1C, but your blood sugar, fasting blood sugar could be 300, and that was okay. And it was like, just inherently, that didn't make any sense, right? And
yeah. It's interesting, because I think I want to make sure I talk about this in a way that's not disparaging to the medical system or to physicians who choose that conventional system. But what drew me to naturopathic medicine was the unanswered questions that I had as a patient. And I've shared this story before, but, it kind of a similar line where, I never got my period. I had primary amenorrhea. And it was a nurse practitioner in an OB-GYN office who was lovely and said, well, we can put you on oral birth control. And then I'm like, well, don't you want to know why this isn't happening? And what about when I want to have kids? And she's like, don't worry, there's a whole specialty around that. They can give you meds to help you have kids. And it just, to me, it was that unanswered question of like just feeling unsatisfied, not knowing what's wrong. And I could hear that in your story too, of just the, that there's that space for everything and that natural curiosity. And I too had that kind of aha moment about naturopathic medicine. That's my training too, as a naturopathic doctor, if you guys don't know as listeners. But I want to talk a little bit about this because we have a ton of brilliant guests and they all find, I'll say this medicine, meaning like root cause oriented, natural, integrative, functional, naturopathic medicine, but they come from a wide variety of backgrounds. And one thing that I've learned from you and heard you teach about and speak about and model is like how naturopathic medicine is unique. And so can you talk a little bit about the context of like what's naturopathic medicine and how is it different from the other types of specialties that are engaging in similar approaches today?
Well, I do think that is wanting to understand the underlying cause. And I think that is what has attracted me and is really crucial, because oftentimes I'll say to a patient, this is not about giving you a supplement at all.
No.
It's about, it doesn't matter if it's a supplement or a drug ultimately, maybe there's less issue there, but it really is about how can we help you identify yourself about what might be going on. How can we engage a person in their health process such that the relationship allows a person to learn more about their bodies, to understand the messages, and to become more empowered about helping to make decisions about their care, make choices that are good for them.
Yeah, I love that. I mean, one of the ways that I think about it is like disease is not a random event for the most part. Sometimes it is, or we can feel that way, or we can't find the underlying cause. But a lot of it is patterns of our genetics combined with our lifestyle that lead us down. But there is an element of control where when you change your behavior, you can change the outcome or prevent an outcome. And I think that's a really empowering aspect of the type of care that we provide.
Absolutely, definitely. And there's an aspect of sustainability to it as well, right?
Talk more about that.
Yeah, because I don't think it's not just a matter of giving a person a supplement. It's a matter of helping them choose within their life what are the things that they can learn how to sustain to increase the quality of their health, because it's not an immediate thing that happens. You can't check all the vitamins, for instance, and go home and say, okay, I'm going to be better in a couple of weeks. It's like if a person has had long-term habits of antibiotic use over a long period of time, or whatever interventions might be the case, just even nutrition from the time they're young, it's like the process of experiencing a quality of health that lets a person stay committed to that requires that they have some experience around it, right? It has to be like, oh, yes, I've noticed this makes a difference. And it's not just about a pill, because oftentimes that might be a temporary fix, but it isn't really something that is sustainable.
Yeah, it's about just kind of like making it so that the light, really ultimately the way I view it is that if I'm doing my job well, you wouldn't need a pharmaceutical or a supplement to be able to live. I mean, if you need that forever and ever, something's not coming together.
Yeah, correct.
Another
Well, and
way.
that takes me to the functional medicine concept. I just want to just step on that for a minute.
Great.
I first met Dr. Bland in 1982 when I was working for the doctor in Sacramento that was had moved from being a conventional medicine family doctor to being the clinical ecologist and nutritional doctor, right? And Dr. Bland said a few years later that he created the concept of functional medicine for MDs and chiros to be thinking in terms of the underlying cause, right? That was the concept. But I think the challenge is that if you don't have that orientation or desire, then it's functional, I guess, I'll use that word, to create a bunch of tests and then give supplements based on that, right? And that is not how he ever meant it to be. That's just how it evolved. But I think it's very challenging, the fact that we have been so attracted to naturopathic medicine, because it really is about what is going on in the body in this person. It's not just in general. It's not just what is the biochemistry, but it's like, let's look at this person. How did they get to this place? What has created the disease they have? And how do we help them access what they need in order to reverse that process? So it's way different than doing a bunch of tests and giving pills.
Yeah. And one way that I explain it to patients is that, we really fundamentally believe that the body has the ability innately to heal itself. And we all experience this. You get a cut, you watch the scab form and then the scar form and then the scar disappears. Our body has the innate capability to heal, and it's always moving in that direction in a optimal state. And so really, I think we think about it as, we call them obstacles to cure, right? How do you remove the obstacles to cure, those barriers to cure? And we're going to get to one of them today, which is stress. But I think fundamentally, this is a very interesting piece, because obstacles to cure sometimes can't be identified on a blood test. It might be a traumatic relationship. It might be, living around chemicals that can't be detected by testing yet. I think there's so many things that come into play there that can impact our ability to heal and cure.
Totally agree with that. And I think that is the benefit of meeting with a person and having a long time with them and getting to know them. My logo is a handshake over the caduceus. So it's about relationship. It's about, we create a relationship. We start that relationship. In the beginning is, I learn about you. I learn how you want to proceed, and then that starts to unfold in a way that allows a person to, learn more, like I said, remove, like you said, identify the obstacles and help a person figure out how they can get rid of those obstacles.
Yeah, the other piece with functional medicine, which I'm a big fan of, I think it's great that more providers from different backgrounds are working with patients in this way. And it's different from a naturopathic physician. I think it's wonderful that people are starting to incorporate this into their practices. So I really enjoy talking with colleagues who come at this from different places. And I also feel a pretty unique advantage having gone to naturopathic medical school in training, because that methodology is taught from the very first year, And I've talked to people who've gone back to medical school. I think about like Aviva Ram as example, trained as a midwife and herbalist, which I think her training was really more naturopathic in origin. Like a lot of herbalists think similarly, right? Then she went to Yale Medical School. And I also have friends who've trained in acupuncture and gone to nursing school, gone back to conventional medical school or gotten an NP so that they have a better scope of practice in their state. And then you end up seeing, or what I hear back from them is like the model is just so different. It's hard to even figure out how to marry the two because it's apples and oranges. So, I do think what a blessing to have chosen the path I chose. For me, it was the right path. And to have that model of assessment and kind of the thought processes that we're trained on.
Yeah, I agree. And we do need it all. And we need it all. We need the people who are going to specialize. We refer, right? Someone who's totally in the specialty field to be able to say, hey, give an opinion, get us your opinion, give us your expertise, and then we can help the patient navigate that road with all that information.
Yeah, absolutely. And I think, we're best at the bottom of the pyramid where it's like the diet and lifestyle management. And then the top of the pyramid is drugs and surgery, if you can imagine those levels of intervention. And ultimately, we're very top heavy in the United States right now. And it's exciting to like trickle into the bottom because we really need more people to address things with patients at that level before you hit the need for drugs and surgery. Like ultimately, that's the great fix if we can get there from a
obviously
healthcare
people want it, because
people want it.
The internet wouldn't be full of all of the people that are doing that, which has its own issues, but you see that there is a demand for it.
Yeah, definitely. And I mean, I love the trends that we see right now with younger generations. Like alcohol use has never been lower. I mean, there's our own, like we have social media challenges and engagement and relationship that I think is on the flip side of that. But generally, I think the younger generation has a lot more proactive interest in health compared to the generations above them, which is going to be amazing. There's this natural tendency to want to seek this out. And that's why we see these companies like Function Health doing the blood testing kind of more proactively, out of pocket, preventively. Like the whole model is starting to really shift, which is exciting.
Yeah, I agree. Cool. Yeah.
Well, thank you for spending some time talking a little bit about that, because I think for people who are listening, maybe you are a healthcare provider trained in another approach, and you're curious about all the different avenues to become kind of a more integrative health provider. Dr. Beeson's an awesome resource, and you've seen like even the iterations of naturopathic medicine and how things have changed over time.
That's true.
Yeah. Well, I want to talk
about that. I've had 20 years of a relationship with the St. Vincent Hospital where our residents rotate to be able to do that seamless work with patients that have cancer. So it definitely is a whole spectrum of care that we are part of the healthcare team.
Yeah, absolutely. You've always modeled that integration. It's not about being a standalone system. It's about being an important part of an overall system. I also, want to just highlight your work with NERC before we dive in, the Naturopathic Education and Residency Consortium, which is a group of physicians all over the country who are working together to provide more residencies for naturopathic doctors. Your clinic was one of the first to be part of that group, and I just appreciate your dedication to ongoing training for people.
Yeah, well, thank you. That was started by Dr. Hudson and I, and it was so that we could create more opportunities for residencies in clinical settings. And basically what I and she do is raise money to be able to support those residencies. So,
yeah, we're a proud sponsor of NERC. It's so great
to be
a part
and
of.
I'm so grateful. Thank you for that. Really
important. I mean, it's something that is really important in order to get great training. We want more residencies available for naturopathic doctors.
Yeah.
So thanks for your work on that.
I agree. Yes.
Well, I want to shift gears a little bit and talk about one of those fundamental pieces of good health, which is stress. And it seems as though today, while we have everything at our fingertips, stress has only increased, even though we have all these tools to make life, quote unquote, easier. I was talking with my husband about this the other day because I'm in that generation that grew up without cell phones. We didn't have the internet. When I was in high school, we got dial-up, or maybe college. I didn't get an iPhone until after I graduated medical school. I mean, there's just like these interesting ways we tell time now. But, even with the onset of email, we think about email and the ease of business with email. You can't imagine living without it right now. But has life really gotten easier with email, or has it just gotten more complicated and faster? So I think, we've really seen these times where stress is really at an all-time high.
Yeah. I agree.
post-COVID anxiety and depression, and like so many people are struggling. Can we talk a little bit about with like the women that you see in your practice? I know you family practice, so not just women, but men as well. In this primary care setting, how do you most often see chronic stress show up?
Oh, well, I think obviously the first is sleep, disruption in sleep. And also probably, well, overeating. I think
Mm.
that's a big way that women get nurtured, particularly a lot of people, but I think with women, it's a self-nurturing. We don't have time when you're working and taking care of kids, and also then that contributes to more stress because the food isn't optimal. And then there's obviously more frequent illnesses, there's digestive complaints. I think those are probably some of the main ways. And maybe also a little bit more difficulty going through perimenopause, which is interesting. I mean, maybe we just have created more of a context for women to be able to express that and complain, not complain, but express, ask for help with it than we had prior. But it's definitely, women are really struggle through it more than I recall in the past.
Mm. I think another thing that's really shifted with that is with women working, but now oftentimes working remotely. There's a lot of isolation. Like when you're in that juggle, there seems to be less opportunity for connection and community than historically. You have to really carve it out and make it.
Yeah, yeah, it's true. Yeah.
So you mentioned sleep, you mentioned GI disorders, which is really interesting because let's talk a little bit about those two pieces a bit more. So, because sleep, obviously people wake up with ruminating thoughts and maybe trouble falling asleep, trouble getting back to sleep. Are do you see those come up with acute stressors, or they just kind of creep in over time?
Oh, I think it's probably both.
Yeah, both.
Some people will tell you I've had trouble sleeping since high school. I mean, there's so many factors when it comes to that. There's the emotional factor, there's safety factors, there's financial factors. Is it a good mattress? What do you have to, and whether there's enough sleep or shift work. Like for instance with nurses, that can be really a challenge. Shift work is a big impact on regular sleep cycles. So.
And what about with GI health? Do you think it's always been recognized that stress can cause GI disruption, or when did we start making that connection?
Well, when it comes to just irritable bowel,
Mm.
I don't think that we heard so much about reflux or GERD symptoms way back when. That was sort of a new thing. We didn't have omeprazole, you know. We didn't have endoscopes. We were using when I first practiced. We were using barium, upper GIs.
Oh, beer as
Right?
well. Yeah, upper GI.
Yeah, so you would do barium for the esophagus and the stomach. So you could really look for ulcers, but you really couldn't look for things like eosinophilic esophagitis or even just straight esophagitis, not unless you really had a large lesion there. So I think that is a huge factor. I mean, think about it, the factor of the upper digestive tract is now you have a food chain that's completely altered. You have soda pops that are so prevalent that weren't prevalent probably even in the 50s and 60s. People did it, but starting when did we start getting those gallons or half
The big
gallons and
gulps.
stuff? Sheesh. Well, yeah, and food, that's a big issue because
Yeah.
really women working and then you have fast food and look at all the fast food places. Well, the first fast food place, McDonald's, was called the Big M in San Bernardino, California when I was in high school, right? And how they're like everywhere. So it's so crazy to be telling people or recommending for like 35 years about people reducing sugar and eating better when our food chains only got worse, right? It's
Right.
like, I've never been to Chick-fil-A is what it's called. Is
Chick-fil-A.
that
My
like,
kids love Chick-fil-A. I've got three
so is it
teenage
good?
boys.
Is it decent? What is it? I don't know.
Well, I mean, I really couldn't speak to it. We don't go very often. Thankfully, they're still like 45 minutes from where we live. So now it's Raising Cane's. That's the one that the boys all want, which is seems to be using more fresh food, but it's still deep fried. It's like deep fried everything and probably made in advance and sent out. And I can't speak to the quality of it, but it's not home cooked meals for sure.
Yeah, well, and so again, contributing to the digestive issues is the stress of a woman attempting to go to work, raise her kids, shop, make food, do the laundry, right? And then, so you're going to go to a fast food. So then you put on top of it a decrease in the nutrition plus the discomfort of what the food feels like in the body, which is the reflux, plus the stress, which is going to contribute to changes in either hypochlorhydria or increased acid production, and then do you even have time to sit on the toilet and have a stool? Or the fiber is so low, so it's harder to have stool. And then, you go through perimenopausal changes when you have changes in the intestinal tract, which also might make it harder. So then you got to introduce some fiber and introduce other things to help their digestive tract work. So just a lot of numerous factors to address when you're looking at the impacts of stress on anybody, but on a woman in particular.
We'll be right back. Here at Precision Analytical, we've launched the biggest update to our report since 2013. The new and enhanced Dutch report puts the most actionable hormone insights right on page 1, making it faster and easier to interpret. You'll see a reimagined summary page, upgraded visuals for estrogen and cortisol metabolism, and an all-new About Your Results section, what we call the Dutch Dozen, a 12-point framework that helps you understand your patient's hormone story in minutes. It's a smarter, simpler, and more insightful Dutch experience. From now through December 19, 2025, all registered Dutch providers can order 5 Dutch Complete or Dutch Plus kits for 50% off. Give us a call or visit dutchtest.com/order now. Must be a registered Dutch provider. Promotion not available through distributors. Can mix and match Dutch Complete and Dutch Plus kits. Prepaid only, no drop ships. Cannot be combined with any other offer. Kits must be purchased by December 19, 2025. Welcome back to the Dutch Podcast.
Yeah, I'm glad that we're talking about this and talking about gut health and the relationship there because it is so interesting. I mean, one of my favorite books, I talk about this on the podcast all the time, is the book Why Zebras Don't Get Ulcers by Zabriskie. It's
right,
an oldie.
Right.
I love
know it.
podcast.
I know it. Yeah.
It's an oldie. But that was really eye-opening for me. I think I first read it in the early 2000s, but every chapter is a different system of the body. And he goes through the science of like what shifts happen. And this isn't new. This isn't contested. There's tons of data out there on this, but we see all these shifts and gut health is such a particularly interesting one to look at because you have, like you've talked about, like the upper GI problems that can happen with stress. You secrete acid differently. That means you digest proteins differently. You secrete enzymes differently. Then you can't extract the nutrients from your food. So that's the first is like your digestive system's ability to get the nutrients out. Then you talked about the complexities kind of that social interaction of when you're under stress, you choose foods that are less healthy due to shortage of time or change in resources that are available. So you're putting less good stuff in. And then the third piece of it that we haven't talked about yet is that the nerves that drive good function in the gut are the parasympathetic nervous system, like our vagus nerve, for example. And when you're under stress and you're in that sympathetic state, the gut's one of the first to suffer. And that's, biologically important, but it's working against us right now. Can you share a bit more about that aspect of gut function too?
I think one of my residents often will ask a person specifically where do they eat? Do they eat standing up? Or how much time do they sit and eat? And I think that's just a really beautiful concept, is to remind people that sitting with your food does definitely supports a relaxation response that is going to enhance the whole digestive process, and that definitely is a challenge for people to find the time to do that when you're running out of the house to get the kids to school and then to get to work, and maybe don't take time at lunch because you're answering emails, back to the email thing, and then at home, what are you doing on the way home to get your kids to sports? How does that dinner happen? So I think the relationship again, support sitting with a person and sorting out like what can you do? Can you take something for lunch and sit with that? Can you do a shake in the morning on the way with some liver supportive type substances, that will allow you to not have to go out of the house without anything at all, So it gets back to the relationship, and I think one of the things that I had wrote in thinking about this was just really helping identifying what a patient can do. What can they do financially? What can they do time-wise? What are their motivations? What's their energy? And where is it that, I always say start with sleep, start with stool, and start with food. And where can you impact those three things on an individual when you're seeing the signs of stress? Everything can't change all at once, but you can certainly figure out with them which of those three things, because I think they're really core, important things. What can you start with?
I love that. And allowing them to get success in one area, it kind of breeds success in the next area because you have confidence that you can actually make a change.
Yeah. And you have not just the confidence, but just the feedback. That's one of the things that we often will start with is a 3-week detox. It's kind of on the pattern that Dr. Bland used to do when he did the FLT program years and years ago, which is 3 weeks, and we do a medical food, and they still have never go without eating, and we always talk about the 5 areas of elimination, right? So making sure that things are moving through the gut, having them do hot and cold of some sort, having them do something to stimulate elimination from the gut, take the rest off the liver by doing the medical foods that supply the ingredients for the liver to detoxify, for the detoxification pathways, and then, depending on what they're taking and the level of their health, adding in some lipotropics to increase the flow of cholagogues, bile and blood through the liver. So it's so amazing the impact that has on a person. It's so educational to say, oh, when I'm not eating these snacks, or because there are snacks, you're eating fruit or vegetables for snacks, but when you're not eating the sugar or the candy or the soda pop, and you're having regular stool, and you're maybe celebrating that with doing a hot bath with some Epsom salts or a sauna and cold, that those core things, after 3 weeks, the person is like, oh my goodness, I haven't felt like this in years, And then a lot of people will come back every year and do it again, or twice a year. But that experience of like what it's like to just invest yourself in just a few weeks of all the ways that our body functions optimally, and what does that feel like? And then knowing which parts of that you can carry on in your life in a way that will help to continue to help you create those habits that are going to support your well-being.
Yeah, I love that, because I think sometimes when people come in and they think about changing something for the rest of their life, let's say it's like cutting back on soda, right? If they love their Diet Coke in the afternoon, the thought of getting rid of that can feel impossible. But if you say, I want you to do it for 3 weeks, along with these other things, most of us can do anything for 3 weeks, right? We can make those changes, and then the outcome of that is what inspires a longer term change. And I've seen that too. And I think sometimes patients are so surprised. Like there's this one group that I've worked with that does weight loss, and but it's very naturopathically oriented. It's like 30 minutes of exercise every day, and then they have a meal plan they put out. But what they teach is whole foods based nutrition and drinking enough water. It's like pretty simple. It's like these 3 pillars: move your body, drink water, eat the right food. Mm-hmm. And the whole food is week 1. Like the whole first week of the program is like, what is a whole food? And they simplify it. And sometimes even by the end of week 1, when the only guidance people have is like, eat food that grows from the ground or had a mother, and that's how they describe it. Just that alone, people are like, I can't believe it. I'm sleeping through the night. Or, gosh, I'm going to the bathroom. Or my mood is better. Or my stomach doesn't hurt anymore. And when you're in these groups and you can hear people's responses just to eating whole food, sometimes it still shocks me how impactful that very simple recommendation can be.
Yeah, I agree. I love that.
It definitely shocks the people that are participating. You can tell.
I do think so. Because the habit that we have in our world of the kind of food that people have access to and they're having all the time, it feels normal, right?
Right.
It's not normal, it's common, but it's not normal. And so when a person is like, oh, that really makes a difference, and that's something I wasn't too hard to do and I can do, that's very powerful. I love
Yeah,
that.
or that feeling of like, oh my gosh, I can feel this way. Like, I think that's the other thing people have. They don't even know where their upper bar is for what good feels like anymore. Like,
Yes.
I can wake up and feel ready for my day and not like I need to go back to sleep and hit snooze. Like that, a lot of people has just that honestly haven't experienced that vitality. And so
That's
that's the
true.
other thing that's really fun about that is you're like raising the bar for people for the potential they feel for themselves health wise.
Yeah, definitely.
So I do want to kind of double click on because you mentioned like in a primary care setting, in a rural setting, one of the challenges is economic, right? And so when you look at some of the clinics that are out there, it makes it look like attaining optimal health is very expensive. It's a ton of testing. Of course, we do testing as well. It's out of pocket cost, it's testing, it's supplements, it's, I don't know, so at home sauna. Can you talk a little bit about within your patient population? How you manage that. Like when it comes to stress, what are the ways that you evaluate? You talked about some of the things that you might see come up for people like sleep, GI disruption, et cetera. And then at what point do you think about adding testing to determine like what needs to be done? So let's start with that piece of it.
Okay, well, I think it definitely depends on the patient and their resources, and what kind of results they're getting with simple things like the change in diet and good stool. Because we're always starting with a regular stool, and it's amazing to me how many people that is the first factor, right? And drinking water, and so their sleep, for instance, is an issue, or just feeling hyper throughout the day, or just really uncomfortable, fatigued. And we've done the basic things, some food, some water, good stool, helping them maybe get rid of sugar. You can't do all of that stuff without more information some of the times because a person needs to be convinced that it's a factor. So I think that the CAR test is a really useful test. I think that sometimes showing a person in black and white what's happening, so the cortisol awakening response can be useful, especially learning to differentiate between whether it's an acute stress or a chronic stress, and showing a person in black and white. Look, this information shows that your stress has been long term, and so let's find some ways to support your body, maybe with some specific nutrients to get you, feeling a little more vital, so you can make these changes. So they're having difficulty making changes or stopping eating sugar. Or this has been a short-term stress. So just by using a couple of these substances, some cortisone, adrenal support substances, people do notice a difference. We have a lot of different ones that we use. And again, as long as that's not the only thing we do, but in the context of a person understanding where the impact of the stress is, again, short-term, long-term, and showing them in black and white that this is what is your salivary testing or urine testing might, the information might give us, can allow a person to not only feel comfortable taking supplements, but then after a couple months, we can also repeat a test and show that they really have made a difference, which is more support for them carrying through with that, or changing a supplement to something else because maybe they've gotten the most out of the one that they were using to deal with more of the chronic issue, and now we need something that's going to address sort of carrying on in a more energetic way.
I love that you bring that up because, one, we resilience is high for a lot of people. Let's start with that. We can carry a lot of balls in the air, keep them up, push through, power through, and feel okay. I mean, there's been times in my life that I look back and think, how did I have all that going on at the same time? Or, you add one more thing, the whole thing could have collapsed. I'm sure you have that too. But a lot of people that we work with, they know. I had one patient comes to mind for me who was trying to get pregnant, and she was like an international lawyer. She traveled all the time across multiple time zones. She worked probably 80 hours a week, and then had all the stressors of work. She didn't have the chance to take care of herself. And when I asked about stress after she described her life to me, she's like, no, I don't really have a lot of stress. And I thought, like, yeah, I think you do, but she didn't recognize it that way. And I think sometimes, my dad says, like, when you love what you do, you never have to work a day of your life. And I feel that way. I feel blessed because I enjoy putting my time into something. So if I'm working or if I'm with my family, it doesn't feel bad to me to be doing it, but it certainly is time sensitive, urgent, busy, go, lots of cognitive processing, but it doesn't have a bad connotation. So a lot of times people don't, I think, self-recognize, oh, I need to slow down. Because it's like you're overflowing with blessings, not with pain. Do you know what I'm saying?
Yeah. Oh, I do. Totally. Exactly. And that is one of the benefits of a testing like that, because I do feel that I've experienced that many times in my life, not just myself, but with patients, is that, like you said, they don't register that it's stress, but the symptoms that they're experiencing are definitely, clearly stressful. From stress, and so to be able to show them in black and white, not just the cortical waking test, but just the adrenal profile, and looking at how the cortisol is metabolized, and whether you're looking at cortisol or cortisone, the ratios between those, and the THF and THE, how that metabolism. I mean, it's very sophisticated in a lot of ways. I mean, it is a sophisticated test to be able to sit down with a person. Yeah, this looks okay. The old tests we used to do, which were the straight salivary, right? But to be able to break it down into all those different components. And it's intriguing to see, oh yeah, this is really showing that things look okay, but this is how your body is breaking down and disposing of the cortisone easier, so that your body is not able to prevent illness as efficiently, or your weight is associated with how your body, the relationship between the cortisol and the cortisone. I think all of those things can definitely help motivate a person to make changes. It's like, it's not just that I've been eating too much sugar for a long period of time. It's that the impact of those things have affected how my body is utilizing these substances. And if I can support my system, then perhaps I can be more attentive to how I am eating, and be able to meet my goals of weight loss a little bit better.
Yeah, you've explained that so well. And I had this same conversation today with Mark Newman, our founder. We were talking about an educational presentation that he's developing, and we were talking about this concept. And one of the things I shared is that when I used to do adrenal salivary testing, I would do like the 4-point or 5-point testing, saliva only, and that's the only thing that was reported. That was kind of advanced of its time, but now that I've seen thousands and thousands of Dutch tests where you can see that, plus you can see cortisol-cortisone ratios, you can see also the metabolized cortisol come out in the urine. It's made me look back and think that I missed an opportunity for like really understanding the process, because sometimes the salivary cortisol curve alone doesn't represent the right picture. When you look at metabolites, or you look at the car, like you mentioned, that picture altogether paints a little bit of a different story. We're working hard to try to like develop better education to help providers.
I think that's good, because it is hard. I really appreciate that, because it is hard to get all that. It's even for me, I've been practicing a long time, and like I said, I'm used to those other ones. And when I started looking at those details, it's like, oh, what exactly does this all mean, and how do I explain this to a patient? Because it's pretty sophisticated. So I really think that is going to help a lot to have that kind of education and simplifying it. Yeah, that'll help.
And I love that you bring up the food piece too, because a lot of this with hormones generally, we always think about production of hormones, but the way the tissues engage with hormones when they enter the cell, the number of receptors, the way the receptors function. It's different when there's, for example, a lot of insulin around or a lot of cortisol around. Like, it's all interconnected, in the tissue. The way the tissues use hormones changes depending on the environment. And stress is one of those big things. Cortisol is one of those things that changes how we utilize even our reproductive hormones. You mentioned that at the beginning, clinically, that you see that like perimenopause is a tougher transition when women are under stress. Like, we need to unpack that more and understand that more so we can share the physiology in a more clear way.
Yeah, I think that's definitely going to be really useful. The more information people have and understanding that it's not the old salivary test. It's really has a lot more components. I think that the metabolites, the THE and the THF, that really is intriguing to me. So I think I can see how that would be really useful in combination with the cortisol and cortisone ratios, and then the 24-hour. That is, I think, it can be extremely useful as an educational tool for patients. So I really like that.
Well, we'll keep working on trying to simplify it, because we know the adrenal fatigue model is not right, but there's not a clear replacement yet out there for really being able to explain these like really complex concepts like you talk about.
Right. Well, one of the things that, on that note, I want to say just one other thing about that is, when I was looking at the DED site for some of the articles or information that you had, I saw this quote by Dr. Tom Gilliams. Did you know that was in 2021?
Yeah.
And he is a PhD, but it was so naturopathic. He says, rename the phenomena, stress-induced HPA axis dysfunction or maladaptation. It is much more appropriate to describe the typical consequences which link stress with the myriad of measurable negative consequences related to the stress response. And this is the core naturopathic part, since most stress-related phenomena start with one of several key hypothalamic triggers, such as perceived stress, glycemic dysregulation, inflammatory signaling, circadian disruption, or feedback inhibition. Successful treatment protocols should be designed to treat these root issues rather than support the adrenal directly. So I think that's just such an important concept, because it's core naturopathic, is how we treat, but looking at the details of it with the testing does allow us perhaps to be able to address that a little bit more specifically, and also to help the patients get a deeper understanding that will help them make the changes that are going to be useful for their complaints. So.
I'm loving this conversation, and I'm going to send you. Tom Williams has a great book, Maggie, that he wrote about HPA axis, and you and your residents would love it. I will send that over to you, because he's written a lot on this, and he's a brilliant scientist. I've had him on the podcast. He can talk circles around like all of us. He's really so smart, and just a wonderful human being, and like interesting human being. He's a naturopath at heart. Absolutely.
Yeah, that's what I thought when I looked at them. Like, this is the core of what we do ultimately, is what I do as a naturopath. Yeah. So
but one thing that's so neat about his approach, like you said, and I love that quote that you read, is I think culturally right now, there is this like high interest in consumers in supplements, and adrenal supplements are skyrocketing in use. And I really like that, actually. I mean, I'm super happy that we're seeing some of these adrenal adaptogens put into drinks and put into food. I think it's really cool, because traditionally that's how they're used. Like, if you look at, rhodiola, Siberian ginseng, you look at Schisandra, you look at ashwagandha, these were like, they were called them rasas, right? They were these food medicines that were just part of your culture. You'd have it in a drink before bed every night. And it wasn't a pill to treat something in an acute manner.
Right. Yeah, I like that.
And so I think it's cool that they're coming back in. And at the same time, they're not a substitute. And this is something that you said at the beginning. It's like, you need to treat the true root causes, not just the adrenal glands production of cortisol, by fixing the things that you mentioned, the stool, the food, etc.
Sure.
Yeah. So I do want to talk about supplements, though, because I know you have a ton of expertise in that as well with adrenal adaptogens. Can you share some of your favorite things for patients or for that you recommend often when it comes, you can talk about brands too. We're not restricted from that, but even if it's just
Okay.
ingredients that you love.
Well, I still do like the protomorphogen therapy a little bit,
Okay,
using
we've not talked about that here. Let's
Yeah.
go into that.
Yeah, so the actual adrenal gland, it's been around forever. I think when we first started when I first started practicing, before we had any naturopathic supplement companies, right? I think ITI was the first. We had Standard Process, and they did a lot of protomorphogen glandulars, and I got some great results with those. So the adrenal support, vital, they have still some adrenal in there, and of course licorice. Licorice can be phenomenal for the solid extract of it for people who don't want to take a pill. When you can
I
just
love
give
the
them,
solid extract.
isn't it? Oh, it's wonderful. Half
It's like,
teaspoon or a quarter teaspoon tastes good.
I would mix it in hot water or like
Yeah,
peppermint tea is one of my
yeah.
favorites. Or you can
People
take it
can
off a
make
spoon. It's like packs a punch.
right, right. Well, and a lot of people like cortisol manager. That can be an easy thing to take. Um, I really am. Excuse me. I really liked the neuroscience company, Dr. Kellerman. I just loved the way that they were. The things they put together based on, they were the first people to really do neurotransmitter testing. And I learned so much from them. I used to do a lot of that testing with them, and the supplements they put together. So they have some lovely support for adrenals, Adricor with licorice, and just even Travacor, or I love what's the other one? Ultra PM, because supporting rest and sleep. I like the idea of putting together some of the 5-HT with some of the herbals. The valerian, love valerian. So not for adrenal, but just for dealing with stress, because it's such a safe herb and such an awesome anti-anxiety. It doesn't always help with sleep, but I also learned from Dr. Bush when he worked for neurosciences, really want to focus on daytime activity when it comes to insomnia. So instead of just giving somebody for sleep, and that would be, again, another use of the adrenal panels, is to say the cortisol awakening response is what is happening when you wake up in the morning. I do love showing people that diurnal pattern, and to say, okay, well, here's what's happening when you get up in the morning. You think you feel super tired? Well, here's where your cortisol is,
Right. Now
And
you
when
can
it's
see
time
why
to
you're
go
so tired.
Yeah, when it's time to go to sleep at night, you've got, the others. So things that can get a person, I think that the cortisol manager does seem to deal with that balance of the excitatory nervous system sort of turning on in the morning, Yeah, so those are some of the ones I love to use.
Yeah, thanks for those suggestions, Maggie. I mean, a lot of those products there's a lot of really great things on the market. And I think the big thing is finding what works for you. I think taking these on a daily basis as a preventive, I mean, that's how they were really used traditionally, which I think is a really compelling option, is like finding a way to include that. And then most importantly, starting with at the beginning with the things that are leading to the problem with that add up of stress. And I mean, just to kind of wrap that up, because you talked about the perceived stress, and that's one thing that I want to just touch upon, because different people have different resilience to stress. And so what might trigger a lot of cortisol production for one person might not even be a blip for another person. Can you talk a little bit about that as well? Because especially with your mental health background, there's a lot that goes into that, but we need to just kind of be cognizant of who we are.
Yeah. Yeah. I mean, I guess, so reframe that a little bit for me so I can.
Well, I think about, for example, we have there's a lot of research today on like trauma and trauma history and our ACE scores, like the adverse childhood experience scores. Yeah. There's even data showing that when mom is under stress during pregnancy, the HPA axis function of the child is affected, even long term. And interestingly, there was one study, it's an old small study, but they put women on SSRI medications during pregnancy for, it might have been anxiety or depression, but certainly for that higher stress. And they found it had no, even though the mom reported a reduction in symptoms, there was no change in the physiological impact to the child, meaning the disruption still occurred. So I just think about the fact that our baseline tolerance can be different for a wide variety of factors, some of which are not in our control. That we need to be kind of thinking about that as well as we move through the world and think about what we can do better to handle stress. You might not carry the same load as your neighbor or friend, and that's totally okay. You got to work with what you got.
Oh, well, the individuality of us, not just in terms of our experience, our history, or like you said, even in the womb, Joseph Chilton Pierce does a whole thing about the limbic system and how it develops differently depending on whether the mother's been in stress through birth, actually what actually happens in the brain development. It's fascinating. But it's also, the resources that a person has to manage the stress in their life. But what was I going to say about our inherent nervous systems? So there is really that. Like oftentimes I will show a person, okay, you've got your excitatory, your inhibitory nervous system, and depending on where you are in your stages of life. So certainly at menopause, you're going to have a lot more tendency towards the excitatory without the balance necessarily, without the progesterone of maybe balance out the inhibitory. So there's just your ability to manage stress there's an inherent part of it. And I think people want to compare themselves. So I think we're getting to that in a way of this person can do this, I should be able to. It's like you don't walk in the other person's shoes. You have no idea all the components that would cause a person to be have less ability to sleep well based on the factors that are coming in, as opposed to another person who slept always like a baby and always will. There's just those factors are just so individualized. And I guess, the only way to identify how that you want to handle that individual basis is to create the relationship. And that's, again, sort of my core as a naturopathic doctor, is that the intimacy of that relationship, seeing a person, listening to them, talking to them, watching how they respond to the questions, or hearing what those stresses might be, listening to all the different aspects of their health, and then what is the best way to support them through that. I don't have a favorite supplement. It's really going to depend. Sometimes it's no supplements, right? Sometimes it's a homeopathic remedy. Sometimes the person says, I don't want to take anything. Or sometimes the person doesn't do anything you tell them they want to do, but they still come back. And then you just say, I don't know what they're getting out of it. I'm just going to sit and listen to them, offer some solutions, and not be attached. Like, I don't believe in non-compliance. I don't believe in it. I never have, right? And I don't believe in hypochondria either. Perhaps it's out there. But, people have different levels of sensitivities. And look now that we know really clearly about liver detoxification pathways, we know that some people's pathways are less intact and are less functional than others. So those people are going to be much more hypersensitive to that or the other thing, right? So then in terms of non-compliance, compliance is like, if a person comes in and they haven't done what I've recommended, I want to know why and what they will do. Not that they should have done it because I told them to, That's part of the relationship for me, is like being able to sit with a person and talk about him. So yeah, we talked about this last time. Oh, I forgot about doing that, or I couldn't do it, or I tried it, it didn't work. That's what helps inform you about what is the next step that allows a person to get their needs met and be successful in trying to assume their health,
Well, that's true partnership for sure. Finding a solution that works,
Yeah, for sure.
Well, what a beautiful way to wrap. I really appreciate your time today, Dr. Beeson, on the pod. Like I said, you're someone I look up to so much. It's been really beautiful to have this time with you. So thank you so much for joining me today.
Thank you very much, Jacqueline. Really appreciate the opportunity. So have a great holiday, and to everybody.
Thank you.
Thanks for joining us on the Dutch Podcast. Join us every Tuesday for new conversations with leading functional health experts. If you like what you've heard, be sure to like, follow, and subscribe wherever you get your podcasts.